I don't want to give up, but I will not give in to coercion.
We want to be midwives, but we can't.
This isn't an ordinary vaccine protest. Many of the thousands here are NHS workers. Many could soon lose their jobs, like Carl, who's been a nurse for more than a decade.
Indeed, yeah, I will, if it continues, will be out of a job on the 1st of April, yes.
Would you describe yourself as an anti-vaxxer?
No, I wouldn't. No, I've had every other vaccine up until this point.
Lots of my colleagues are in the same boat, and they're potentially losing livelihoods and jobs and food on the table when we've been working through the pandemic.
The rules are that to keep their jobs, frontline NHS workers need to have 2 jabs by April. That means they need to get their first dose in February, 2 weeks from now, and that is why you see the real urgency here today.
And beyond protest, politicians are uneasy too.
We saw a lot of people vote against it before Christmas. I think that number would be rising. And as we come to the crunch and we see that actually there's still a lot of people who haven't been vaccinated, do we really want to see these big crises that could be caused in certain parts of the country? Because all of a sudden, a whole lot of people are not on the front line simply because they haven't had this vaccination.
Last week, the Prime Minister said the government will reflect on the way ahead.
Any pain or swelling, just take some paracetamol for 24, 48 hours.
But reports of a pause to the policy have today been dismissed as the Royal College of GPs call for a delay in a debate not just about ethics, but logistics, with warnings as many as 70,000 NHS staff could lose their jobs.
So mandatory vaccination is a government policy, but as healthcare professionals, we all have a duty to make sure that we are protected, to make sure that our colleagues and our patients are protected. So I know that our teams will be doing everything they can to continue to have vaccine confidence building conversations and offering that all-important vaccination to staff who are yet to have their first, second or their booster dose.
It's a policy that's stirred debate and emotion too. A Prime Minister keen to cling on to his own job will have to think carefully about so many health workers losing theirs. Ali Fortescue, Sky News.